videos. So today we have Krunal Desai here, who is here on a mentorship on a clinical attachment, and we've had a very interesting case. So let me tell you a little bit about the history of what this case is like. So we had an implant on a canine, which is the eye tooth, which was unfortunately failing. And because of the failure, it had also compromised the tooth next, which is further forward. And what we had to do today was we had to remove the implant. And this creates quite a big defect. Because the tooth next was compromised, we also had to remove that. So we took the implant out, we took the tooth out, and then we grafted the area. And what we used to graft this is we used human bone. So we used human bone blocks that come from a human bone bank. And that's what it's called. It's called Rocky Mountain. So what happens is we then fixate this bone block onto where the defect is. And then what we do is we then put some bone granules around it, which is also human bone. And this is made by a company called BioHorizons, and it's called Mineros. We put these bone particles all around. And then what we do after that is we then use a membrane, and that's the membrane we use called evolution. We put the membrane over it, and then we stitch everything up. And that was one of the cases we did. And the case in the morning we did was an extraction of a premolar, and we did an immediate implant there. And all in that, we've also had some impressions. So Krunal, how's your day been today?
It's been excellent, really, really good. Starting off with the first case, it was an immediate case of failing upper premolar, extracted it, removed all the infection, and then placed the implant immediately in the appropriate position, and then closure. A really, really good case, and a really good result.
Good, good. What about the second case? How did you find that?
That was fantastic. It was a failing implant. Learned a lot, even using an explantation kit to remove an implant, and then shaping the appropriate size bone to fit into the defect, and then the closure is also important. So yeah, a really, really good case.
Excellent. So these are the kind of cases we do at the clinic on a daily basis. So if you're ever interested in your mentorship, DM me and I'll get back to you. And have a nice day, guys.
Great, thank you.
Bye.